body kind of swings to the left a little bit. It's kind of hard to see from this angle. At the rotator cuff, all of them essentially are eccentrically contracting, especially the infraspinatus and teres minor here. And then at the wrist, the extensor carpi radialis, longus and brevis are both eccentrically contracting here as as my wrist flexes here. All of these muscles are involved in decelerating the movement of my arm and shoulder. Now, a tear of a shoulder labrum is an injury that an athlete could experience that would greatly hinder their upper extremity movement as a whole, let alone throwing. So the labrum is a connective tissue, right? Is a rim of cartilage that lines and reinforces the ball and socket joint of the shoulder. So when the shoulder is subluxed or when the shoulder is completely dislocated, it often causes tearing of that labrum in the shoulder. Now, a possible cause that is seen in throwing athletes is the end portion of the throw. So like football quarterbacks, as seen here, which I'm not a quarterback, or baseball pitchers, at the end of the throw, when there's too much stress placed on the shoulder, as it decelerates, this oftentimes causes a lot of stress to be placed on that labrum, which can result in tearing. So the labrum also has two primary functions. One is to ensure that the humeral head stays in place. The second is that the labrum serves as an attachment for surrounding tissues. Therefore, when the surrounding ligaments of the shoulder are torn, it is possible that the labrum is also pulled off the rim of the bone as well. So with a tear of the labrum, the shoulder will lose stability. Common symptoms include pain, weakness, decreased range of motion, and laxity in the shoulder, all of which will make a skill such as throwing overhead extremely difficult or unable to perform. So the shoulder will not be stable enough to withstand stress from the shoulder going into full external rotation or going into a great degree of external rotation, and it will not be able to generate a lot of force and then decelerate at the end of the movement.